This is kind of the thing that we see with the kids all the time. We ask the parents and the teachers, you know, what's wrong with Johnny? You know, why are you concerned about him? And they'll say, well, you know, Johnny's such a smart kid and he always does so well, but lately he's just not living up to his potential. He's an A student, but for some reason he's performing at a C level. And in many cases, those kids are smoking marijuana and not necessarily having to smoke it every day. They can be smoking it occasionally and still have effects from it. So, is marijuana addictive? You know, it's for a long time people have thought, and still do, that marijuana is not addictive, that again it's harmless, it doesn't cause addiction, it's a benign drug. Compared to other drugs, it really isn't as bad. We clearly know that marijuana is addictive. I think that debate is over. The people that choose not to believe it just aren't going to believe it no matter what you tell them. But the data out there absolutely has concluded that marijuana is addictive. It causes tolerance, it causes dependence, it causes withdrawal symptoms, which go with dependence, and it absolutely causes behavioral symptoms and things like compulsions and cravings and loss of control and continued use despite consequences and all of that. Marijuana produces tolerance in the sense that your body needs more to achieve the same effect. Your brain adapts to the drug, just like any drug that you use that gets you high. And marijuana absolutely qualifies for that. There is a withdrawal syndrome associated with marijuana. People don't think so. Marijuana is both psychologically and physically addictive. Yes, the physical part is mild compared to some other drugs. Heroin, alcohol, sedatives, things like that. They are much more physically addictive. But I'm going to talk to you about some symptoms that are still very difficult for people to deal with when they stop smoking marijuana. And they are things like cravings, irritability, trouble sleeping, mood swings, loss of appetite, anger. I mean, if you're having trouble going to sleep and you're irritable all the time and you're having these mood swings and you're just really generally just not feeling well, you're anxious, you're depressed because you haven't smoked in a week, what's the tendency going to be? You're going to go and relieve that. You're going to go and smoke some marijuana so you feel better. And just like any other drug, that's why we have such high relapse rates, because people cannot manage those symptoms. Not to mention that once you get over the initial physical symptoms, and these symptoms can last anywhere from 1 to 3 weeks with marijuana, sometimes longer. Again, remember, its effects linger. So it's not like some drugs that within a few days they're out of your system. The effects of marijuana hang around a long time. There's something called post-acute withdrawal too. And what we know is once you get over the initial physical difficulties, the stuff that's really uncomfortable, you go into a phase that's more about the psychological. And that can last for weeks or even months with marijuana. Not uncommon for me to hear people say, you know, I'm not sleeping. I haven't smoked in 2 months and I'm still not sleeping. I'm not hungry. I don't feel well. I'm anxious. I'm irritable. And that's why people end up resorting back to the drug. And adolescents, or you know, happens to adolescents just like it does to adults. What are some of the secondary symptoms of addiction? What happens to someone's life? Well, every area of your life is impacted. And adolescents are no different. Legal problems, trouble at school, family issues, problems at home, financial difficulties, employment, everything is affected. And the interesting thing is that kids are affected more quickly and in more ways than adults are. Again, we go back to that brain development thing, right? They say now, we used to think your brain was fully developed by about 21, right? Yeah. The insurance companies have known this for a long time. Now, actually, the more recent data is saying 24 or 25, I think, right? Peggy, is that right? 24 or 25. So if you're 13 and 14 and you're starting to smoke marijuana, you are much more prone to have all these things affect you and impair you. and you are much more prone to become addicted. In fact, NIH has done some studies. Some of them were several years ago, but what they found is that most addiction overall begins in adolescence. So the adults that are out there today that are addicted to one substance or another started using when they were teenagers. And many of those people started using marijuana. So that executive part of the brain that we all have, you know, that prefrontal cortex, that part that's responsible for kind of, you know, managing your impulses and weighing consequences and thinking rationally and making good decisions for yourself, that part of the brain in adolescence is not fully developed and isn't so until their early 20s. So, you know, parents, you all are that executive part of the brain for kids. You are the ones that keep them, you're the ones that set the boundaries. You provide the structure because they're unable to do it for themselves. And it's hard enough to raise a teenager today without throwing something like marijuana into the mix. The younger they begin using, the more likely they are to become addicted. I'll give you a couple of trends here, and then we're going to wrap it up, and I'm going to hopefully answer some questions for you. And, I pulled up the 2009 Monitoring the Future survey. This comes out of, this is NIDA, I think, National, isn't it NIDA, Peggy? So they go across the country and they survey teenagers, and they ask them about their attitudes, you know, involving drug use, and they ask them about involvement with drug use and things like that. There's a disturbing trend happening. Actually, if you look at 2009 versus 2008, there is actually a slight increase in the number of kids, or the percentage of kids that have used marijuana. And I'll give you the numbers. 2008, 8th graders reported, 5.8% of 8th graders reported that they had used marijuana in the past month. 5.8. That's across the country. I'm sure that number would be higher if we just surveyed Miami. That number has increased to 7% in 2009. 10th graders, same thing. Past month, use of marijuana in 2008, 13.8%. This year, that number has grown to 16%. 12th graders, past month, 2008, 19.4%. This year, 2009, 21%. So not a huge increase, but certainly not a trend we want to keep going. Here's the more disturbing part.
So what kind of action we take?
Disapproval among 10th graders towards those who smoked marijuana occasionally and those who smoked marijuana regularly lessened. So more, I take that to mean more kids approve, right? Among 8th graders, those who perceived great risk of harm associated with smoking marijuana occasionally or regularly declined. Again, remember, perception of harm. Do I think this is bad? Is this something I would do? Is this something I want my friends to do? And I got to tell you that we have a big problem. We have a huge problem in this community, and it's about that. It's about the perception of harm. And it used to be, at least when I was growing up, that you knew who was smoking marijuana. You could see them. When I was growing up in high school, you could look at the people and you knew they were smoking weed. You can't do that today. It's all kids. It's all types of kids. It's kids you would look at and never think that it's kids from Gulliver and Palmetto and Columbus and Ransom and Palmer Trinity. It's no longer, you know, those kids. And I see it all the time. And I see how widespread it is, and I see how accepted it is among teenagers, and I even see how accepted it is, or, you know, maybe not accepted, maybe that's not the right word, but I see how parents tolerate it. And I don't think we should tolerate it, because I think that's dangerous. It's a very slippery slope for us as parents and people who care about kids. And we need to be clear.